Mom, we have a doctor's appointment. You better hurry up.
Yeah, I know that, Christine, so we have to go, okay?
Okay, Mom,
Then
hurry
I have to
up.
first
Okay.
this one.
Just hurry up, Mom.
Okay, I have to go now to the bathroom.
Okay, I'll check your purse.
Okay,
Is
check
your
it if
health
I have
card
my
is in
health
here?
card, okay?
Is everything? Oh my God, Mom, what's happened? Oh my God, are you alright? Then call 911.
My hair!
Good morning, Mrs. Z. My name is Lorna. I am a nurse. I'm in charge to you this morning. How are you?
Good morning. So it's already morning. I thought it's still afternoon. How about my appointment with Dr. Carter?
Yes, Mrs. Z. It's already morning. Today is April 19th, and your daughter told me about what happened yesterday upon your admission, that you fell in the washroom and you fractured your hip. Unfortunately, today is your first day of post-op.
Is that so? How about Dr. Carter? He will get mad on me. I need to get out of bed. I need to go to the doctor for my
Okay,
appointment.
Mrs. Z, don't worry. We understand that. Actually, your daughter already called Dr. Carter to inform that you already here in the hospital, that you fell in the washroom and you fracture your hip, okay? Okay, Mrs. Z, can you please relax, because I'm going to take your vital signs for us to continue to monitor your condition. Okay? It won't take long.
Okay.
Okay, Mrs. Z, I got all the information that I need, so I'm done with my assessment with you. Dr. Smith will check on you in a couple of minutes. Is there anything I can do for you right now?
I just want to get out of here soon. I want to go home.
I can see that this is a difficult situation for you, but we're closely monitoring your condition to help you recover faster. For now, I'll just give you the call bell. Please use this call bell every time you need us, okay? And please don't try to get out of the bed, because it's not good for you. You're gonna be fall again, okay? And we don't want that to happen, okay? Okay.
Hi, Nurse Lorna. How is Mrs. Lee?
Hi, Dr. Smith. I just finished the assessment from Mrs. Z. Here is the information. Actually, the vital signs are slightly irregular. Blood pressure is 110/84. Respiration is the one that's slightly irregular because it's 38, and the pulse is 108. She is diaphoretic and pale. pedal pulses are present, and capillary refill is 2 seconds. She still complains about the pain though.
Oh, well, everything seems good to me, except for the other vital signs. Continue monitoring it, and neurovascular checks every 4 hours, okay?
Okay.
And then
Got it,
check her
Doc.
IV. It must be D5.45% normal saline, okay?
Okay.
75 milliliters per hour.
Okay.
And then give her IV PCA with morphine sulfate, 1 milligram per hour.
Okay.
Continuous infusion. And assure that we maintain a clear diet fluid, okay?
Okay.
Got everything?
Yes, I got everything here.
Okay.
Thanks.
Thank you.
You're welcome.
Hi, good morning, Mrs. Z. I'm Dr. Smith. I'm the doctor in charge of your condition. How are you doing?
Doc, good morning. So when will I go home?
Mrs. Z, we're still closely monitoring your condition. If there would be no complication, I'll be able to send you home as soon as possible.
Doctor, can you explain to me what really happened to me? And then why I'm suffering like this?
So, you suffered a fracture in the hip. People in your age are usually in a higher risk of acquiring this injury because you have fragile bones and a minor trauma occurred. Your hip can break in different places. A hip fracture can be within the joint, which we call intracapsular, or outside the joint capsule, which on the other hand we call extracapsular. Your hip joint is known as a ball and socket joint. The ball head or head of your thigh or bone or femur fits into the socket of your pelvic bone to make your hip joint. This socket is called acetabulum. There is a strong but flexible joint capsule that surrounds the hip joint. It helps to give stability to the joint and also produce a fluid called synovial fluid to give lubrication and help joint movement. Your hip can also be displaced or non-displaced. A displaced fracture is a fracture where the bones have moved out of their normal position. If a bone's fragments have moved, they need to be put back or reduced into their normal alignment. In a non-displaced fracture, the bone fragments, even though they are broken, are still aligned in the normal position.
Doctor, may I know the signs and symptoms of fracture?
If you break or fracture your hip, you will feel a lot of pain around your injured hip. So typically, this is the most pronounced over the outer part thigh of the thigh or in the groin. You will be unable to move your hip or stand or walk. The affected leg often looks shorter and is turned outwards compared to the other leg. You may also feel lightheaded, but both due to the pain and also because of the broken bones that may bleed internally, and this can cause your blood pressure to fall.
But doctor, I need to go home. I want to go back with my regular life.
Be careful with your leg, okay? Mrs. Lee, if you comply to our medical regimen, you'll be out in a few days. In the meantime, I'll consult my physical therapist to assess if you are ready to go home. Is that okay?
As I was to do my morning care for Mrs. Z, I noticed the following behavior. She does not turn her head if spoken to from the left side. Left hand and arm are elevated in a pillow, and she is also wearing an anti-embolic stockings, and she is still restless. Therefore, I made a nursing diagnosis of risk for injury related to acute confusion as evidenced by trying to get out of bed.
Hello, Dr. Smith speaking.
Hello, Dr. Smith. This is Lorna. I am the nurse in charge in medical surgical unit. I called to inform you about Mrs. Z, 72 years old, female patient.
Yes, what about her?
She experienced shortness of breath and labored breathing. She is very confused and is trying to get out of bed. She is in her second post-day up of her hip fracture. Yesterday, she has an unilateral neglect. She has a past hypertension history with enalapril as maintenance drug. She had a flu a week ago. Yesterday, she had unilateral neglect on the left side. She's under D5.45% normal saline IV solution at 75 ml per hour and IV PCA with morphine sulfate and 1 milligram per hour. Continuous infusion and is in clear fluid diet.
Any actions done yet?
I made some assessment and found bilateral scattered crackles in the lungs. Vital signs was checked. Her respiratory rate is 38, which is irregular, and pulse oximetry dropped down to 92%. Her pulse rate is also irregular because it's 108. Productive cough and whitish sputum is noted. Can you please come and see her as soon as possible? And also I'm going to request for the sputum exam.
Okay, yes, I will. But for now, just maintain her oxygen levels and monitor her vital signs. I'll have the lab to get her sputum sample.
Okay. Thank you.
Thanks for the heads up. I'm on my way. Bye.
Hi, good morning, Mr. Z. How are you
Hi,
today?
good morning. I'm fine.
I'm Tracy. I'm the physical therapist today. I was given you a referral from Dr. Smith. I'm actually here to assess you, okay?
Yeah.
So I'm going to prepare you to go home, okay?
Okay, I think it would be better for me.
Oh, okay. Okay, Mr. Z, I'm going to ask you to point your toes towards the floor for me, please. Okay, and then I'm going to ask you to point them towards your nose. Okay? Thank you. That is so good. Okay, Mr. Z, Nurse Lorna is going to assist me taking you out of bed, okay?
Okay.
So we're going to ask you to kindly move your left leg over.
Yeah, the strongest one.
Yeah, the
and
strongest leg, and then we're going to ask you to move. We're going to assist you in moving the other leg over, okay?
That's right.
Okay. I'm
Yeah.
ready.
Okay.
We're just going to take a few steps today, okay?
Yeah, okay.
Okay.
Perfect. Okay.
Dr. Smith, how are you today?
Hi Tracy.
Hi.
How's Mrs. C doing?
She is not doing too bad, to be honest. I saw her day 2 post-op.
Oh.
She was able to move, not freely on her own, but day 2, we did take her for a walk. Nurse Lorna and I took her for a walk with the walker, and she did well with the assistance, you know. She's
good?
She's getting there.
So I
Okay.
can let her go home now?
You should be able to make that decision, but based on my report, she's okay.
Okay.
Yeah.
Thank you, Tracy.
You're most welcome.